It can be hard to be going through a flare. You may think, oh, I've been stressed and that's why I have a flare, but now I have a flare and I feel more stressed. Hi, this is Sarika Ramachandran. I'm a board-certified dermatologist. Today we're going to talk about what to do if you have a psoriasis flare. So a psoriasis flare is when the disease is exacerbated or made worse in some way. This can mean that areas that have been relatively well controlled are starting to become more irritated. They may note that it's redder, pinker, more purple, changing in color. It may be becoming more scaly or thicker, more elevated off the surface of the skin. Sometimes it's also important to see if there might be something in your life that's going on that's making the psoriasis worse. So is there something that's triggering this flare? In some cases, there's certain medications that may flare psoriasis, and talking to your physician about your medication list may be helpful to see if that might be coming into play. If there is a life stressor going on, that may trigger a flare of psoriasis. If there's some type of an illness or something else that's affecting your body, then you may also be more susceptible to flares at times. So figuring out if you have a flare can be helpful, and then figuring out beyond that how to approach that change is important.
That was great.
Good.
Wonderful.
That.
Let's run it one more time.
For psoriatic arthritis, one of the first steps is really to have a physical exam to see if there is pain, swelling, tenderness, or some other change that may indicate that psoriatic arthritis is involved. Once that's been diagnosed, it's important to touch base with your physician to figure out if treatment options have changed or need to be adjusted based on the fact that psoriatic arthritis is at play. Rheumatologists can be helpful in evaluating and coming up with good treatment options. Sometimes they will also employ the assistance of a physical therapist who may be able to guide safe movements or movements that may be helpful. I think it's important to employ as many professionals as you can that can guide you on a good pathway to address the many things that can be associated with psoriasis and psoriatic arthritis. Please, I implore you. Knowing that it's a flare, it's important to start treating. Oftentimes that may mean increasing the frequency of a topical steroid if that's what you've used for your psoriasis in the past. If something you've already been using is not helping, it may mean switching medications. Perhaps you've been using topical steroids, it's helped in some areas, but now there's a larger body surface area involved. Then it may mean that it's time to move on to a more systemic medication. Sometimes having somebody to talk to, well equipped in talking about stressors can be helpful to have on board. Talking to your doctor about what treatments may be able to break the cycle of psoriasis can be helpful because getting that under control may help with some of the stressors that the psoriasis is actually triggering. Sometimes it can be overwhelming in terms of how to apply topical medications, remembering to apply topical medications. I like using the trick of putting little alarms and little reminders of when to use medications. There are support groups out there as well. Also, just taking a step back and thinking about what might be helpful for you or what has been helpful for you with your stressors in the past and how you may be able to integrate that into your life now to help kind of alleviate some of the things that you're going through associated with the psoriasis. Thanks so much for watching. I hope you found this information helpful on how to address psoriasis flares. Please hit subscribe on the Healthline channel for more videos like this.